This video is meant to understand pneumococcal vaccine and its uses. So currently in market we have two kinds of pneumococcal vaccine. One is a conjugate vaccine and the other one is a polysaccharide vaccine made with a polysaccharide capsule of the pneumococcus. Now pneumococcal vaccine is used against Streptococcus pneumoniae to prevent its infection, and generally it is known to cause pneumonia, meningitis or sepsis. So all these three can be prevented to a level with the use of pneumococcal vaccine. Now pneumococcal vaccine, either a conjugate vaccine or a polysaccharide vaccine, has different uses. Going on to conjugate vaccine first. So by term conjugation we understand that pneumococcus is being conjugated with something. So here we use either the 10 most commonly occurring serotypes of the pneumococcus or either the 13 most commonly occurring serotypes of the Streptococcus pneumoniae, and we conjugate these serotypes with a non-toxic strain of diphtheria toxin. So these 10 serotypes or 13 serotype get conjugated with a diphtheria toxin that is non-toxic, and we get our conjugate vaccine that is known as PCV. So either we can have a PCV 10 or we will have PCV 13 based on the number of serotypes we have added to a non-toxic strain of diphtheria toxin. Now note that this conjugate vaccine is preservative free. One of the advantage of this vaccine, the temperature required is 2 to 8 degrees Celsius, another advantage. Okay, and the basic regime that we follow is that WHO has already recommended to use this conjugate vaccine as a part of immunization program. Okay, and in India we are doing so. We have added this as a part of our national immunization schedule, and in India we use two primary doses. The first PCV dose, that is PCV1, is given at 6th week. The second PCV2 dose is given at the 14th week, and the booster dose, PCV1 booster, is given at 9 to 12 month of age. Okay, this is a regime that is being followed in India NIS. And either we can also follow a 3 primary dose regime plus a 1 booster, but this is what is currently followed in India. This is one of the image of PCV13 conjugate vaccine. We can see how it is written that it is used intramuscularly only, and it is also to be remembered that it is conjugated with diphtheria toxin. So these were what were the use of a conjugate vaccine. Also note some of the side effects of the vaccine that are very few. That is, it can cause erythema at the site along with tenderness. Okay, this is one of the side effects. Systemic side effects are very less known with PCV. One more thing we need to remember is the PCV vaccine is given regardless of the medical condition. If the child has HIV, still this vaccine can be given. So means immunocompromised child can be given PCV. Plus this vaccine can also be given in sickle cell disease. But note that in a HIV patient, to keep the titer at a level, we have to repeat PCV doses multiple times. Okay, this is to be remembered. So these were bits about PCV vaccine we needed to know. We'll go on to understand why polysaccharide vaccine was made. So for adults we made a different vaccine, that is a polysaccharide vaccine. By polysaccharide we mean we have taken actually 23 most commonly occurring Streptococcus pneumoniae according to the sites, and then we have made a polysaccharide vaccine from these 23 Streptococcus pneumonia, and this is known as pneumococcal polysaccharide vaccine, that is PPSV 23, made with the 23 most commonly occurring Streptococcus pneumoniae. So we already had a vaccine for child, so this vaccine was is actually made for adults use and for children who are more than 2 years. But remember, this is contraindicated in 2 people, that is, we know, in a child less than 2 years, and if the person is immunocompromised also, this vaccine is to be not used. So where is this actually used? So this is used in cases of post-plenectomy, because in post-plenectomy as well as sickle cell disease we have increased risk of infection with capsulated organism. It is also to be used in chronic diseases of heart or say lung diseases which are chronic, or we have kidney diseases, CKD. Okay, in these diseases we need to use the PPSV 23 to prevent pneumococcal vaccine, as well as a chronic malignancy, organ transplants. These are some condition we need to know where PPSV3 is used. So here we see how a 0.5 ml pre-filled syringe with needle is given for a PPSV23 vaccine use, sold under a brand name Pneumovax. So these were bits you needed to know about pneumococcal vaccine. Hope you liked that. Thanks for watching.